What was your most memorable experience serving as president?
I think the most memorable experience at ASDS, and this might have been just as incoming president, was when we had the president's dinner and everyone was making fun of me, which was great. But it was at Tiger Woods Golf Club in Orlando because the meeting was in Orlando, so we got to see his green jacket. He didn't come, but he had other things to do. But it was kind of at the height of his career, so that was really a neat experience and would not have happened without ASDS.
What were the issues facing the society at the time?
Well, it was a tough time when I was president. We had the great financial crisis or the Great Recession, whatever you want to call it. And we had issues with worrying about our finances. We had to worry about whether we're going to fund an industrial advisory committee board meeting because we knew that would add like another $50,000 to the cost. So we had to deal with that. The other issues were there was a movement to do a procedural dermatology board. And all of our members were telling me that we're not proceduralists, we're dermatologic surgeons, and that we should not allow this to happen. So I testified at the AAD board, and ultimately this concept of a procedural dermatologist was abandoned. And I think that turned out to be a very good thing, and I was happy to be able to fight for ASDS on that point.
What were the most significant innovations in dermatology at the time?
At the time I was president, the most important innovation was the introduction of fractional lasers, the concept that you can treat only a portion of the skin with little dots and the skin will react like it's been treated in its entirety. So prior to that, people were thinking about full face resurfacing and long recovery times, and we were fortunate enough at that time, due to the work at Harvard, to introduce to all our members the fractional resurfacing concept, minimizing patient downtime, and maximizing results.
Who was your most memorable patient and why?
That's a tough one because of HIPAA regulations. Obviously, I can't mention any names, but I think that probably the first patient that I've ever treated with endovenous ablation, because we were the ones who developed endovenous ablation. Dr. Goldman and myself went to we went to the labs at, sorry, my mind. Let me just say that again. Okay. So the most memorable patient was the first patient I ever treated with endovenous ablation, radiofrequency. That patient had had varicose veins for 20 years, and we did this brand new treatment. It was in the year 2000 or so, and we did a non-invasive treatment. The patient came in, laid down on the table. We put a little catheter in the vein. We sealed it from the inside. The patient walked out. When I saw him back at 6 weeks, no more varicose veins. So that was really an incredible moment, and certainly one of the most appreciative patients that I've ever had.
And looking back at your career, is there anything you would change or do differently?
No, I think looking back at my career, I feel very fortunate to have been admitted to a dermatology residency, to become a dermatologist, and then to become interested in dermatologic surgery, and particularly the cosmetic aspect. It's been great. It's fun. It continues to be fun. I love coming to work, and many people look forward to retirement, but I don't. I'm really happy, so I have no regrets, and I'm really happy with the path that I chose.
What advice would you give today's young dermatologic surgeons?
For young dermatologic surgeons today, I think there are a lot of distractions with social media, and I think it's really important to continue to focus on patients and patient satisfaction and improving outcomes and not to be distracted. So I see people sometimes maybe criticizing each other on social media, and I think my advice is that's not a good path to follow. I think what we really need to maintain is our educational and patient focus, because that's how we're going to move this society forward.
What are your predictions for the future of the specialty?
So in terms of the future of the specialty, and particularly for ASDS and surgical dermatology, I think we're going to see things like optical coherent tomography. So we're going to be able to not only look and analyze skin lesions with our eyes, we're going to be able to use instruments to actually get a diagnosis on the spot. I think that is going to help us be more accurate. I think we're going to see more scientific evidence. We're going to remain not treating cosmetics based on anecdotal evidence, but based on real hard evidence. So right now, for example, RF microneedling is in its earliest stages, and people talk about it for acne scarring and for maybe neck tightening. I think as the future progresses and as we get to a future time point, what's going to happen is that we're going to have some really much better studies, and we're going to be able to base our decisions on treating patients based on facts and not anecdotal evidence.
What advice do you have for ASDS leadership in serving its membership in the future?
For ASDS leadership going forward, I think the most important thing is to remain the scientific basis that we are, to continue doing the clinical trials, to develop new cosmetic treatments, to advance the ability to treat skin cancer, and to just make sure that we have all the tools that, as they are being introduced into our specialty, and to make sure that our membership has the opportunity to learn about all those new tools, devices, and techniques.